Okay, so this evening is our stroke presentation being done by Dr. Landau. Dr. Landau is a neurohospitalist and vascular neurologist with Capital Health. Sorry, lost my page. One second. Okay, with Capital Health Inpatient Neurology team. Dr. Landau is board certified in vascular neurology and neurology. He received his medical degree from New York University School of Medicine in New York, New York. He completed his residency in neurology at Montefiore Medical Center in Bronx, New York, where he also received his fellowship training in vascular neurology. Dr. Landau is a member of the American Academy of Neurology. Thank you for joining us this evening, and the floor is yours.
Thank you very much for having me. Can you hear me?
Yes, yes.
Okay, great. So yes, thank you for having me. And the importance of this talk is that the month of May is National Stroke Awareness Month. And I see strokes on a day-to-day basis at work, and I hope to just shed some light on some information regarding strokes, what they look like, some of the symptoms, some of the risk factors, and different ways of treating stroke. So without further ado, we'll continue. So yeah, some of the basically the four main things that I hope to address today will be basically defining what exactly is a stroke and some different facts and numbers, statistics about strokes, what puts people at risk for stroke, recognizing these different risk factors and ways of trying to modify them if possible. When someone is having a stroke, how do you recognize it? And then once it's recognized, how do you treat it to help improve someone's outcome? So those will be the big picture of what we'll be looking at today. I'm sure everyone here has heard of the word stroke, either if they've known somebody with a stroke or just seen it, heard about it. Not everyone might know precisely what a stroke is. So what a stroke is when the blood flow to the brain suddenly gets interrupted. And it can happen for a variety of reasons. But what's very important is that it's very sudden. When someone has a stroke, the symptoms really are can be in the blink of an eye. You could be completely fine in one moment, and then the next moment you can have a variety of symptoms all at once. And so the large majority of strokes are what are called ischemic strokes, and that's when the interruption of blood flow is caused by something that is blocking the artery. It can either be a blood clot or plaque that's built up and is blocking blood from getting through. A smaller percentage of strokes are involved with active bleeding, and that's when basically blood leaks out of a vessel and then it enters the brain tissue, and that causes damage. So both of these types of strokes can look similar, but they're different mechanisms and there's different treatments. Today we're going to be honing in mostly on the ischemic stroke. It is the one that is far more common, and it is the one that has more treatment options. So, and one other type of, it's technically a stroke. Maybe you've heard of something called a TIA. It stands for transient ischemic attack. It is when someone has symptoms of a stroke, but they're only temporary. They go away, and then afterwards your symptoms are gone, and that's due to a temporary blockage. But then the body gets rid of that blockage. So those are basically the main overview of the different types of strokes and what's actually happening in the brain when someone's having a stroke. So this is just looking at what I was explaining, but just in a more visual depiction. So just one fact.
Isn't that discriminatory?
So strokes are about 700 95,000 are occurring every year in the US. And I was mentioning that the large majority of them are these ischemic strokes, which in this picture, this little diagram is showing the inside of an artery, and this red portion is a clot that's blocking the blood from getting through. And when that happens, when there's a blockage, it leads to a region of brain that is not getting blood flow. You lose oxygen to that part of the brain, and that brain becomes injured and dies. And that is what is happening with an ischemic stroke. And then this other type of stroke, a hemorrhagic stroke, in this picture, this little bubble is what is, and it's called an aneurysm, and that is a little outpouching. And if that gets large enough, it can rupture. And if it ruptures, it causes bleeding out into the brain. And this other cluster of blood vessels it's a different type of reason that people can get a hemorrhagic stroke. But again, I'm going to be focusing more on this ischemic stroke, since this is the one that's far more common and treatable. So some more statistics about stroke. I already mentioned about how many people are getting strokes every year in the US, about 800,000. It causes a great deal of disability. It's the number one leading cause of disability in the country. It's the number 5 cause of death. So what that's saying is that people very often will survive the stroke, but it's a wide variety of outcomes. Some people return back to their normal life. Some people can no longer walk. Some people have somewhere in between. So depending on really the stroke's type, how big it is, it can lead to many problems down the road, or it can actually lead to no problems down the road. And then, so strokes are happening basically every 40 seconds. Someone dies from a stroke about every 4 minutes. Stroke kills more than 137,000 people every year. On average, someone dies of a stroke, as I said, every 4 minutes. So these are just some of the numbers. And now that we've identified what a stroke is and really how it's happening in the country, these are different reasons why people might get strokes and what you can potentially do to avoid them. What's interesting is about roughly 4 out of 5 strokes, 80% of strokes, can be potentially prevented by what are called modifiable risk factors. And these are very common conditions that tend to occur in people as people get older. Hypertension, which is another word for high blood pressure, heart disease, atrial fibrillation, that's a certain irregular rhythm of the heart, diabetes, obesity. These are all often interrelated. They put people at risk for multiple conditions. Stroke is one of them. It also puts people at risk for heart attacks, for lung disease. But each of these different processes can be prevented if it's caught early enough. And that's what is appealing about stroke, is that a lot of the time, if steps are taken early, strokes can be avoided and prevented. Another big risk is smoking. Smoking is it causes plaque to build up. It can often really get the arteries in your neck and head to be very plaque ridden, and those plaques can just over time obstruct blood flow, and plaques can break off and get into other smaller arteries and cause stroke. So these are all things that could be addressed by a primary doctor and hopefully prevent a stroke from happening in the future. Now, there's other risk factors that are unfortunately not modifiable. One of the most important ones is age. you see stroke by far and away happening as people get older. It's not to say that stroke is only excluded to certain age range. I've seen people with strokes in their 20s and 30s, but it is far less common as people get older into their 70s, 80s. It's far more prevalent. So age, your sex. Now, it's not as big of a difference, but there are differences amongst men and women. Your family history. So if you've had a mother or a father who've had heart disease or who've had strokes, there may be a higher risk of the son or the children of having those same risk factors when they get older. Race, ethnicity is something you're born with, and there are certain backgrounds that tend to have higher stroke risk than others. And then your genetics. So there might be certain genetic conditions that you're born with that unfortunately put you at higher risk of stroke. And these are certain conditions that have an increased risk of clotting. For example, sickle cell disease is one of them. There are other less common ones, but this is just an overview of different common things that can be a cause of stroke. So I was mentioning age. So the reason why people tend to have strokes as they get older, it's there's a process that occurs over time. So your blood is flowing throughout your body in your arteries, and those arteries, as you get older, they don't have the same elasticity and sort of flexibility as they do when you're younger. And as you get older, because of the stiffening of these arteries, your body tends to have to pump its heart more hard, and when it's doing that, it causes hypertension or high blood pressure. And high blood pressure, it's often affiliated with high cholesterol, and then there's other things that can be affiliated with this. Diabetes can be affiliated. But this process of the stiffening of your arteries, that's something that is not really something that can be avoided. It just happens as people age, and that basically starts a chain of events that puts people at risk for stroke. So that is, I think, something that is it's just an unfortunate reality of life as people get older. I mentioned men and women. Now, men and women do have many of the same risk factors. How there are some unique risk factors that women have that men don't. That includes pregnancy. So there are the woman's body during pregnancy has a higher tendency for clotting. So that could potentially be a cause of stroke. Now, that's not to say that you shouldn't get pregnant, but just there can be a slightly higher risk of stroke in pregnancy. Also, certain birth control medications are related to increase in clotting, which can lead to stroke. Migraine headaches, which obviously affect both men and women, do tend to occur higher in women, and there is some association with migraines when coupled with smoking of migraines being linked to a higher risk of stroke. And then just some other numbers here. The number of women dying from stroke is twice as much as dying from breast cancer. So I know that breast cancer is by far and away more common in women than men, but it is important to know that on the grand scheme of things, stroke is actually tends to be more detrimental over the whole population. And it's not a large number, but there are slightly higher numbers of women dying from stroke than men, but it's not that large of a difference. And stroke is the leading cause of disability in women. And in terms of ethnicity and race, there's really a higher prevalence of stroke in African Americans than other racial and ethnic groups, leading to more extensive physical impairments. does tend to be a higher occurrence of risk factors. About 2/3 of Black Americans have at least one risk factor for stroke. So that could be one of the causes of more strokes occurring in this group of people. So now that I've explained some of the different reasons why people might get strokes, what can now be done to prevent this? Since I was mentioning perhaps 80% of strokes could maybe be prevented. So I think it all boils down to just getting in the habit of following up with your primary care doctor. You actually don't want to ever have to encounter a neurologist. It's really all the work is up front at your primary care doctor's visits. At these visits, they'll be checking your blood pressure, they'll be checking your routine blood work, they'll be looking at your cholesterol levels, they'll be looking to see if you have diabetes. All of these things can be managed very effectively with a combination of lifestyle changes, and if that's not sufficient, then also medications. So being active, whether it doesn't have to be running marathons, but having a regular level of exercise and activity is always helpful. Your intake of food, avoiding high sodium, high cholesterol, these are things that can help also lower risk of stroke. Because the higher, the more weight someone has, the higher the chance of that leading to being associated with diabetes and high cholesterol, which is, again, this chain of events that can lead to other complications involving stroke, heart attacks, etc. I mentioned earlier smoking. Really, any smoking at all it can be very detrimental. I know if someone has a long history of smoking, it can be quite a challenge to quit, but I would encourage making all attempts to, if possible. And then I mentioned about medications. This is something that you would have to just discuss with your primary care doctor. Some people, even if they've never had a stroke, if they've had certain risk factors, a commonly prescribed medication is the over-the-counter baby aspirin, but not everyone can be on it. I wouldn't advise it until you speak with your primary care doctor whether that would be beneficial for you or not. But yeah, in summary, then, really just being active on getting really yearly checkups with your doctor is a great step in the way to preventing strokes. So now that we've discussed really what a stroke is, what are some of its risk factors, how you can maybe try to avoid a stroke, how do you know when someone is actually having a stroke? So this is where a simple mnemonic, it's called F.A.S.T. Each of the letters stands for something and can be a big a game changer in someone's outcome if recognized quickly. So the F in the mnemonic F.A.S.T stands for face, and that means that if someone is having a droop on one side of the face, as you can see in this picture, if the face just looks asymmetric, that could very well be a sign of a stroke. The A stands for arm. So if one of the two arms is having difficulty, it can be very prominent in the fact where you can't even raise it at all, or it could be more subtle where you may be able to lift it but just have difficulty holding on to things, or you might be just clumsy if you're trying to write your name, for example. So that's what the A is, arm. The S stands for speech. So speech can be whether the words just are coming out very jumbled, or even knowing what you want to say but not being able to say it. That could be a sign of a stroke. So that's what S stands for. And the T is not a symptom, but rather an action. It's related to time. The moment something does not seem right, the quicker that you get to a hospital, the quicker you can be treated. And there's a saying in neurology, in stroke and neurology, that time is brain. Brain cells are dying when a stroke is happening. So every minute counts. The quicker that it's recognized, the quicker you can be treated, and the less damage occurs, then the better the long-term outcome. So that is, in a nutshell, what can be done to try to lower the symptoms of a stroke. Now, these things, the F, the A, and the S, they're only some of the possible symptoms, but they are some of the common ones. So this next slide is going to show some of the other symptoms. So this is mentioning it mentions the F and the A from that mnemonic, but it could also be the leg. And what I think is very important to stress is that strokes tend to affect only one side of your body. It can affect both sides, but it's very uncommon. But the far more common scenario is when it's only one side. So if one side of the face is asymmetric, one arm is weak, or one leg is weak, they can all happen it could be face, arm, and leg. But if it's all on the same side, that's a very strong indicator that this could be a stroke. I mentioned, sorry, I did mention S about speech, but it could also be a comprehension issue of not understanding what someone is saying to you. So it doesn't have to be your own speech. It could be someone else's speech that you're unable to process. And that might be more subtle to pick up on, but it could actually be a sign of a stroke. This was not mentioned in the mnemonic, but vision can be a sign of a symptom or a sign of a stroke. If you're having difficulty seeing, it can be just one portion of your overall vision. If you're having trouble seeing on the left side, like out of the corner of your eye, and it happens suddenly, that could be a sign of a stroke. Another one that was not mentioned in that mnemonic is balance, and that can be just having difficulty walking, feeling dizzy, like the room is spinning. Now, there is overlap. Some of these symptoms of strokes don't have to be a stroke. They can be other things. So that's what does make recognizing a stroke a challenge. Some of the symptoms are very unique to stroke, like the one-sided weakness. But some of these other symptoms are not unique to stroke. Like people can have dizziness for a wide variety of reasons. So that becomes a little bit more challenging when it actually is a stroke that's causing it. And then this last one, sudden severe headache. Now, headache is really the major symptom when you have the bleeding type of stroke, the hemorrhagic stroke. Headaches are not the most common symptom when you're dealing with the most common types of strokes, these ischemic strokes. So headache should not be that high on the radar unless it's one of these bleeding strokes. And in that case, it tends to be the worst headache of life. Never had a headache as severe as that before. So again, these are a variety of symptoms. I don't want to get too complicated, but I'll just reiterate some of these. The facial droop on one side, you can see the picture here. The arm weakness, dropping things on one side, that's very important. Slurring of the slurred speech, the garbled words. These words, dysphagia and aphasia, that basically means knowing what you want to say, but unable to get the words out. I didn't actually mention this earlier, but numbness. Numbness is when like if you go to the dentist and you have Novocaine when they work on your mouth, and when you get that Novocaine, you can't feel anything. That's what numbness is. So numbness sometimes is a sign of a stroke as well. And that tends to also be only on one side. So if you have numbness on one side of your face, one arm or one leg, that could be a sign of a stroke. And then these other ones on this side, these are the more challenging ones. Difficulty walking, dizziness, balance issues, visual symptoms. These tend to be overlapping with other possible causes that are not stroke. So they're not as easy to identify. As I was mentioning earlier, this ischemic stroke, the one that's the non-bleeding type of stroke, that's what I've been focusing on because it is the one that's far more common, and there are treatments that can be done when it's occurring. So an important type of stroke to recognize in the hospital is something called an LVO. It means large vessel occlusion. So I was mentioning earlier that strokes occur when an artery becomes blocked by whether it's a blood clot or whether it is plaque. Now, the arteries in your brain, there's many of them. Some are large, some are small, some are medium sized. The larger the artery, the more severe the stroke, the larger amount of brain that is affected. So that's why this one is such these large vessel occlusions are so important to recognize because they can be fatal. They have the highest rate of mortality and the poorest outcomes. Now, the types of treatments that I'll be talking about on the next slide are geared towards these large vessel occlusions. There's been a large change in the way strokes are treated since around 2015. That was when I was actually in my residency. 2015, there were about 5 different landmark studies that showed that there's surgical interventions that can be beneficial for stroke. So this word here, thrombolytics, that's just a big word for a medicine that breaks up clots. So thrombolytics have been the mainstay for treatments of stroke for decades. And they have variable rates of effectiveness. But surgical interventions were never shown to be helpful up until 2015. And that has changed the way stroke centers throughout the world are set up because of the effectiveness of the surgical interventions. So the 2 types of treatments, these thrombolytics and the actual surgical procedures, they're called endovascular procedures, they can be actually used in combination with one another and can be the most effective way of treating a stroke. So here's just another diagram of just a brain, and this little egg is trying to show a stroke affecting this region of the brain. The yolk, the center of this egg, is demonstrating the very center, the core of the stroke, the core of where all of the injury is occurring, and then the white of the egg is this area called the penumbra. The penumbra is the part of the brain that is not yet injured, but is at high risk of becoming injured. The very center of the stroke is called the core, and that is the part that's usually injured right away and cannot necessarily be saved. But the penumbra, that's the part of the brain that is at risk, and if you act quick enough, you can save that tissue and lessen the overall damage done from the stroke. And I mentioned this already, time is brain. This penumbra, as time passes, becomes smaller and smaller, and the yolk gets bigger and bigger, and it comes to a point when actually there may not even be any treatment available if too much time has gone by. Here's another picture of these 2 different treatments. The thrombolytic, the name of the medicine, it's called TPA, tissue plasminogen activator, and this is a clot buster medicine. It's demonstrated in this sort of these green dots, and there's this sort of red cluster of cells, and that's the clot. And what this is trying to show is that the green medication comes in and breaks up the clot. In theory, that's really nice, but in reality, it's not as efficient as one would hope. It really only has about like a 30%, 1 in 3 benefit, whereas 2 out of 3 people actually don't get much benefit from this TPA medication. The quicker, however, the quicker that it's given, if it's given within an hour or 2 hours, you get much more improvement than you do if it were to be 3 or 4 hours. But that's this medication. This other one is a diagram of the surgical procedure. And this is a little mesh wire that it's called a stent retriever. And that will it basically grapples around the clot and you physically just pull it out. So if there is a clot stuck in a major artery, this procedure is very effective at getting it out. It's more, I think but this in combination with the medication can really improve outcomes from stroke. So this is just, again, reiterating some of the things I was mentioning about these treatments. TPA, it's the medicine that breaks up the clots. Now, there's a limitation to this medication. Because it's a very strong clot buster, it's a blood thinner, and it can actually cause bleeding in certain circumstances. If too much time has gone by, if 4.5 hours have gone by since the beginning of the stroke, that's when you start losing that key penumbra, and the tissue might become permanently injured, and you can actually cause harm if you give this clot buster. It can cause bleeding into the stroke. So you really only want to give this medicine within 4.5 hours, and that's something that is prioritized whenever someone is potentially having a stroke. The ER will alert the hospital about it, and everyone will rush to see this person over everyone else because it's so time sensitive. There's other reasons why people might not be eligible for TPA. If you're on certain blood thinner medicines, if you had recent surgeries, there's a variety of things. So sometimes, unfortunately, even if you make it to the hospital within a very quick time frame, there might be other factors that prevent it from being safe enough to give this medication. And as I was also saying, the surgical procedure, these actually have a longer time frame where it's safe to go in. It can even be up to a full day, full 24 hours. Now, not always. It all depends on how the blood vessels look, how the brain looks. We do lots of quick imaging in the hospital to determine whether it's safe to go in and try to do it or whether it's too risky. But the benefit of this is that this time frame of 4.5 hours makes it very challenging when someone has a stroke in the middle of the night. So someone goes to bed, let's say 10 o'clock, they go to bed, and they wake up in the morning, 7 o'clock, and they have symptoms. One side of their face is weak, one arm is weak, they're slurring their words, they're having a stroke, but you don't know what time it started. It may have started at midnight, it may have started at 3 a.m., may have started the moment they woke up, may have started at 6 a.m. So when you don't know the time that it started, you have to err on the side of caution and use the furthest time back when it may have occurred. So these are called wake-up strokes, and they've classically always been ineligible for acute treatment until we've had these surgical options. So if a person cannot get TPA because you don't know what time it started, they still might be able to get treatment with that surgery because there's a longer time window for this. One unique thing that we have at Capitol Health is something called a mobile stroke unit. It looks just like an ambulance, but what's unique about this ambulance is that it has a CT scanner, which is it's a way to image the brain. They have it equipped on the ambulance. Most people who if someone's having a stroke, the ambulance comes, they rush them to the ER, and then all the treatment starts when they arrive to the ER. But this mobile stroke unit, you can actually get the treatment started before arrival to the hospital. They get their CAT scan done in the ambulance. they'll call the neurologist, they'll do a video evaluation on the truck before they're in the hospital. And if it looks like it's a stroke, if they meet all the check boxes, then they can give this clot buster medicine. They can give the TPA right there in the field before arriving into the hospital. So that really can cut down on the time
I'll do that.
to treat a stroke had this mobile stroke unit not been present. However, the mobile stroke unit does not, you can't do surgeries on here. So the surgical treatment is still going to be the same time frame once arrived to the hospital. But that really is, in a nutshell, just an overview of the different really basics of what a stroke is, the signs and symptoms, the different risk factors, and what could potentially be done when someone is having a stroke. So I already had this slide up, but I want to just reiterate it. Remember the basics. When a stroke strikes, act fast. So recognize the signs that are common: the drooping of the face, the weakness of an arm, slurred speech, difficulty understanding, and then acting very quickly. That can be a life changer, the quicker someone comes into the hospital. And then there's one last mnemonic that I didn't mention, but the FAST, it can be preceded by BE. The B stands for balance, and the E stands for eyes. And I was mentioning that these are some of the symptoms that are harder to recognize, whereas the other ones are easier. But it is important that if there is balance issues, difficulty walking, if there's symptoms of vision, difficulty seeing out of one eye or both eyes, those also could be signs of a stroke, but just a different part of the brain might be affected from that. And I believe that concludes the discussion. Or any questions?
I have a question.
Okay.
I have a question. How can you
Yes.
tell, is there some way to see inside your arteries? To see
Yeah.
if there's an indication on a healthy person. We think you're healthy, but you don't know.
Yeah, so the way that would be done, there's different ways of doing images. One of them is called a CTA. It's called it's a CAT scan angiogram, and what it does, you give contrast, iodine contrast, and you do a CAT scan at the same time, and that contrast will light up the blood flow in your arteries, and that will show whether there's any narrow arteries or any blocked arteries. Now, it's not really routinely done at a routine doctor's office, but if someone is having a possible stroke, that's one of the main tests that we do. So when someone arrives to the hospital, the test that they will get, they'll always get a CAT scan, which is a very quick picture of the brain. And then very commonly, we'll also do this what I just said, this CTA, and that will look at not just the brain, but the blood flow to the brain to see if there is a blockage or not. There's other things, you may have heard of Dopplers, carotid Doppler. That's a common one of looking at the vessels in your neck to see if there's plaque buildup there. That's something that is often ordered as an outpatient if there's some concern. Another way of looking at the blood vessels is an MRA or an MRI. The MRIs and MRAs are more advanced ways of looking at the brain and the blood flow to the brain. They take longer to get done, so they're typically not done when someone's having a stroke, because the emphasis when a stroke is happening is to get things done very quickly. But MRA is another way of looking to see if there's a clot or a narrowing. Okay.
Yeah, we have a question in the chat box as well. It says,
Oh, how do I open the chat? Let me see that.
I can read it out.
Oh, okay, okay.
It says, do you recommend getting a cardiac calcium scoring test to determine the amount of plaque in the arteries, which can cause a stroke?
It's not something that I routinely have done. Uh, it might be something that cardiologists do, but it's not something I've ever done. At least I primarily see people inpatient. Potentially that could be something done as an outpatient, but it's not something that I routinely recommend.
That was the only one we had in the chat box. So if
Okay.
anyone else has any questions, you can unmute yourself and ask the question. Or you could put it in the chat box as well if you don't feel comfortable unmuting yourself.
Hi, can I ask a question?
Yeah.
Yes, go ahead.
I apologize if you already covered it, but I didn't hear. Are there any foods associated with maybe lowering your risk? You know, like you hear red wine for, heart and things like that. Is there anything for stroke?
Yeah, so there's a Mediterranean style diet can be beneficial for preventing stroke. So basically more fish and less red meat, more sort of nuts and unsaturated oils, like not saturated fats. But yeah, Mediterranean style diet is one that can be lower in terms of risk of stroke.
Thank you.
Mm-hmm.
And then, sorry, one more if you don't mind.
Oh, go ahead.
If you do have a genetic predisposition to, maybe parents having strokes, is there anything preventatively that you can do when you do meet, or is there anything I should be asking my GP when I go for my annual?
Yeah, if like, let's say parents have had either heart attack or stroke at a young age, then you may want to have just more like an echocardiogram to see how the heart is contracting, or there's not one particular test, but I think just doing it at an earlier age, trying to catch it before it occurs. But yeah, the common things that could run in family, there could be certain heart conditions where the valves may not be, there might be something called like a leaky valve, and that might be something that a cardiologist would address. And that would be, you can get an echocardiogram could detect that, an EKG can detect things. If there's certain arrhythmias, I mentioned AFib. Now, AFib is not necessarily genetic. That's something that can develop really in anyone as you get older. But you might, if you see a cardiologist, they might recommend a Holter monitor to see if your heart is undergoing any kind of an arrhythmia that can be a risk of clots that can lead to stroke. Yeah, so if there's any unique condition that a parent has, that same condition will be you can search for it in yourself, but a lot of it does tend to be heart related if it is genetic. But the other genetic types of conditions deal with clotting. There's a wide variety of not so common clotting disorders that sometimes people need to be on blood thinners. There's certain blood tests. There's something called factor V Leiden deficiency, which is not that common. But if you have one of these abnormal clotting disorders where you have a tendency to form blood clots, then you might be indicated for a blood thinner at an earlier age than someone else might.
Another question. Another question in the chat box is, are there any type of supplements or vitamins that might be helpful to avoid strokes?
Not really that I'm aware. I mean, it's having vitamin D is always good for multiple things for your bone health. But nothing really that I could think of that's unique for stroke. So nothing really. The main things are really just keeping your cholesterol at a good level, keeping your blood pressure at a good level, avoiding diabetes. Those are really the main things. So there's no particular supplements that I can think of, or vitamins, but multivitamins are just good for general health anyway. It's not necessarily unique to stroke though.
And how much vitamin D is another question.
That would really depend if you have osteoporosis or not. That would be a better question for really a primary doctor. I don't have that answer.
Okay. It says, does varicose veins have anything to do with this condition?
No, so varicose vein. So there's two main ways that blood get through your body. There's arteries and there's veins. Arteries are the main problem when you're dealing with most strokes. Varicose veins are in a different part of the body. They're typically not affiliated with stroke. So that could lead to other conditions in your legs, but it's not really associated with stroke.
Okay, that was the last question in the chat box. I just wanted to remind everybody, Rosemary said thank you for answering the question.
You're welcome.
To fill out the survey, it's in the chat box. So if you have any questions about getting to the survey, you can just copy and paste it in your URL and you should be able to open it that way. But if you have any other questions or you can't get to it, just let me know and I'll be able to help you. And I don't believe there's more questions. So thank you so much for joining us this evening, Dr. Landau. Your presentation was very informative and I'm leaving with a lot of information. So thank you for that.
Oh, thank you for having me.
Yeah.